How's it going, guys? Cody, guys, back again, dropping yet another video. You can hear sirens. Sounds like an ambulance, that, doesn't it? Right, guys, this is a story in the Independent. Again, more prison news. The headline reads, "Thousands serving community sentences have undetected mental health problems." Now, this is classed as an exclusive. Fears for thousands of people trying to cope with mental health conditions without support after being through the criminal justice system. More than 10,000 criminals serving community sentences are likely to be suffering from undetected mental health problems, increasing their risk of self-harm, suicide and reoffending, according to analysts by The Independent. Figures obtained via the Freedom of Information request reveal the identification of such conditions among where people serving non-custodial terms varies widely across the country, but in almost all areas, fall short of the government's own assessment of their frequency. Some 91,293 people are serving community sentences in England and Wales, and the government estimated in July last year that 35% were suffering from mental health condition. However, the rate of people self-reporting a mental health need on starting a community order ranged from 10.6% in London to 35.6% in Kent, Surrey and Sussex, according to data obtained from the Ministry of Justice by charity Revolving Doors Agency and shared exclusively with The Independent. If the government's own assessment of the prevalence of mental health conditions is correct, that would indicate there are nearly 4,000 people serving the orders in London alone who are likely to be suffering from mental illness but have not reported it. Nationally, the detection rate averages out at 23.57%. That indicates a total discrepancy of some 10,435 people whose condition are undiagnosed and therefore trying to cope without the support they may need to stop them harming themselves or from harming others. Lord Keith Bradley, the author of a landmark report on people with mental health problems in the criminal justice system, said, "The Ministry of Justice figures highlighted a fundamental problem in supporting offenders in the community with mental health related disabilities and complex needs. The data suggests that the level of information being shared with the CRC is not robust enough," he told The Independent. "There's inadequacy in screening problems to properly identify all those with mental health conditions, and where the information is collected, it is not effectively shared along the criminal justice pathway to ensure that at each point there is the most knowledge of the needs of the individual so that interventions are appropriate to those needs." Lord Bradley also suggested the lack of appropriate care could contribute to high levels of reoffending. More than a third, or 34.1% of adults, reoffend after starting an order. People in the community are not properly connected to the support services they need to ensure the problems they've encountered, which may have led them into the criminal justice system in the first place, are addressed, he said. The data comes as self-inflicted deaths are revealed to be leading cause of death among those people serving community sentences, accounting for almost a third, or 31.1%, in 2017 to 2018. Those on community orders are also more than 10 times as likely to die by suicide than the general population. Rory Stewart, the prison's minister, lauded community orders over custodial sentences for crimes including burglaries and shoplifting when he spoke last week about the possible scrapping of jail sentences of 6 months or less. "In my responsibility to protect the public is safer if we have a good community sentence rather than putting people in prison for short sentences, and it will also relieve a lot of the pressure on the prisons," he told the Daily Telegraph. David Gauke, the Justice Secretary, suggested greater use of community sentences when he axed plans for new prisons for women in June of 2018. He also announced plans to improve access to mental health support for offenders in the community in August of 2018. Following a Ministry of Justice study that highlighted very low use of treatment requirements as part of a community sentence, 5 piloted sites were launched to trial mental health referrals for vulnerable offenders in the community. Less than 1% of community sentences handed down in 2010 included a mental health treatment requirement, and their use halved between 2013 and 2012, and 2017 and 2018, falling from 0.6 to 0.3%. Legal think tank the Centre for Justice Innovation urged the Ministry of Justice in December 2018 to urgently reconsider the level of funding available for drug and mental health treatment, for offenders in the community and reconsider whether the funding should be ring-fenced. Phil Bowen, the director of the Centre for Justice Innovation, said, "Effective community sentences cut reoffending and cut crime, but for the public and the courts to have confidence in them, it is vital that health and justice services are brought together to divert people with serious mental health conditions from short custodial sentences through improved access to treatment." Charlotte Douglas, who's 54, personality disorder and depression, and is serving a community sentence in London. She was a repeat offender, having served a custodial sentence, and feels support has been inadequate. "I should have had trauma therapy. That is what I know now, 9 years later," she said. "There was no diagnosis, no care plan. When you tell them, the offender managers, about emotional problems they give you a number for Samaritans and Crisis Line. You feel disappointed and rejected. Without support, you can have more problems and can get into more trouble. It's a catch-22. I've been crying for help for a long time, and it shows." Professor Charlie Brooker, the Honorary Professor of Criminal Justice and Mental Health at Royal Holloway, and one of the authors of an investigation into the prevalence of mental health conditions in the probation population, said improved mental health training for offender managers was needed to sufficiently support those on community sentences. In a 2-year programme, a day and a half was spent on mental health, he told the Independent. "This is not anywhere near enough to be able to access with any confidence someone's mental health status." Christina Marriott, the Chief Executive of Revolving Door Agency, said questions need to be asked about why CRCs understand the mental health needs of people serving community sentences, why they are failing in the first step of identification, and what actions they are now taking. For the community sentences to work, CRCs must be able to identify mental health needs, she said. This is the first step to getting people the health care they need. And this can not only help people to stop reoffending, it can save lives. People on community sentences have a suicide rate of 10 times that of the general population. A Ministry of Justice spokesman said, here we go. As with other members of the public, the mental health and those serving community sentences is assessed and treated by trained medical professionals, not their supervising probation officer. Community rehabilitation companies work closely with healthcare partners to ensure offenders receive the support they require. We are piloting a new pioneering scheme that sees offenders in 5 areas diverted towards treatment for mental health and substance misuse to tackle the root cause of their offending. Ministry of Justice, guys, pisses me off that. Come out with the same rigmarole every time. They've got an answer for every question. Rather than putting their hands up and saying, you know what, right, we're failing people, right? They're not. But like I say, mental health services, guys, are inadequate sentencing. Now, you're talking about that they're not focusing on custodial here. You've got custodial, obviously, prison, and you've got non-custodial supervision orders and such, community payback orders like that that's been alluded to here. Now, like I say, a lot of prisoners, before they've ever been offenders, and I've said this in a lot of my vlogs, they've actually been victims. And what I mean by that is they've grown up in care, they've been sexually abused, physically abused, emotionally abused, bullied. They've got mental health issues underlying that have not been diagnosed or undetected. Might have been bullied, parents might have been addicts, might have grown up in care leavers. The reality is that a lot of these people go on to reoffend, whether it be through addiction, where they've got to steal to feed themselves or feed their habit, or violence, or whatever the case may be. And like I say, a lot of people that are going through these community orders and community payback orders and supervision orders and such are some very, very vulnerable and susceptible people in society, guys. Now, I have more faith in community sentences than I do a custodial sentence, obviously on short sentences. Short sentences are just counterproductive. But yeah, of course, there is definitely a correlation between people that are suffering with mental health issues and stuff and are 10 times more likely to take their own lives because they're going through the criminal justice system, and then they just go to probation and stuff. Probation would like you to believe that, oh, you sit down with a psychiatrist, they look at your background and stuff of your doctor and your mental health and stuff, and that's just not the reality. And like I say, guys, it leads on to self-harm, suicide, and also reoffending as well, because it's very hard to break the cycle of crime. There's not much really else to say on that, guys, really, is there? It's just the system's failed. The system's as broken as those that are going through it really, really are. For anyone that doesn't know, community payback orders are, prison's one avenue from a judge. Obviously, you've got many others, conditional discharges and such, fines, and going through probation, supervision orders and such, right? Now, a supervision order, like I say, what it is, you can work in the community. You might be like getting graffiti off a wall, or you might be working in a charity shop, or you might go around and litter pick or paint something, and like you're there, you're in high vis, there's a sign put out saying community payback. It's embarrassing. It's productive, in my opinion. It's far more productive than throwing somebody in prison. And like I say, it's just one avenue that they can send you down when it comes to sentencing. People that should be in prison are not sent to prison. People that are in prison shouldn't be sent to prison. What I mean by that is I've seen paedophiles harbouring hundreds and thousands of images of indecent images of children. They get a suspended sentence. Someone doesn't pay a parking fine or assaults a police officer, section 39, section 47, assault, and they go to prison. I don't know. System's corrupt, guys, as much as I can say. I'm going to leave it there, guys, anyway. Let me know what you think about the video. Link in the description below, like I always do. Like, comment, subscribe. Cody out.